When your child is diagnosed with congenital heart defect, it's kind of a overwhelming experience. And understanding who can help you and who to reach out to will help you in your child's journey.
Well, the Cardiac Center is unique because it's the only organization within the country that combines cardiologists, cardiac surgeons, intensive care physicians, and anesthesiologists, all dedicated to the care of children.
Everyone has the same objective, the same missions for patients with acquired or congenital heart disease. This is all that we do.
I am the patient care coordinator, the nurse coordinator, who helps the family navigate their way through our system.
I'm a pediatric cardiologist, and most typically we take care of kids who are born with heart defects or structural problems of their heart. And I particularly spend a lot of time taking care of kids with risk factors for future heart disease like high cholesterol or high blood pressure.
I'm one of the heart surgeons at the Nemours Cardiac Center. I do heart and chest surgery on kids, starting with babies who are born with heart problems. I also do surgeries for children who develop heart problems later, including heart failure, may need heart transplantation or mechanical devices to assist their heart.
You have a long period of training that involves general surgery and then cardiothoracic surgery in adults, and then you train to do surgery in pediatric population.
One of the most important parts of coming in for heart surgery is the trust that you have for the surgeon who's going to be performing it and the team who's going to take care of you. We're very proud here of the extraordinary outcomes that we have. Our outcomes really rank among the best in the country.
A transplant coordinator has a role that involves education of the patient, education of the parents, explain what is it that entails to live with it after a transplantation to get the most out of that transplantation.
I'm the director of the cath lab, which includes diagnostic catheterization and, most importantly, interventional catheterization, which is the treatment of heart disease through the blood vessels without incisions, without open heart surgery, things that the patients had to undergo open heart surgery for, and now we're doing it in the same day or overnight.
Our role as an intensivist is somebody to take care of the babies when they're critically ill, or the children that come in, but also to coordinate our care back and forth with cardiac surgeons who may have operated on the babies, or the cardiologists who might have sent the children in.
So electrophysiology is a study of arrhythmias. I specialize in managing patients who have heart rhythm abnormalities, heart rhythms that are too fast, heart rhythms that are too slow, patients who have pacemakers, patients who have defibrillators, and we take good care of our patients.
We have an excellent group of nurses in the Cardiac Center. They are very dedicated to the care of the patients and the families.
The cardiac ICU nurses are highly trained to take care of cardiac patients. The ratio is usually 1 patient to 1 nurse. The nurses are at the bedside of your child 24 hours a day.
I'm the director of the nurse practitioners and physician's assistants in Nemours Cardiac Center. There's the attending physician, such as myself or the cardiologist or the surgeon, and then these are the next people in line taking care of the children in the ICU. Many of them have been here since we've started the Cardiac Center, so they've been a tremendous asset.
There are 4 anesthesiologists in our division. All of us are very experienced in taking care of kids with heart disease. We are to relieve pain and suffering, which is really kind of a great job. And when you put that in the context of working with children, it really is a very rewarding professional pursuit.
I'll be careful with her, I promise.
All of the resources we need to take care of a patient with any problem are really right here. I can have them here in a heartbeat. If I'm concerned about a patient I'm taking care of, they're just down the hallway in the next office on the phone. I can just get them immediately.
The way we work is extremely collaborative, which makes it extremely efficient. Like a nephrologist, a neurologist, a GI doctor, having that capability readily available is exceedingly important, particularly when you care for the smallest and the sickest patients.
We have a clinical psychologist that works with us. We have a developmental program which we follow the infants from the time after they've had surgery out to 3 years. We have a therapy department that can work with physical therapy that the child may need, an occupational therapy, as well as a speech therapy department that can help with children that have feeding difficulties. And we have a respiratory therapy department that is dedicated to our team. We have a genetic counselor who works with us. A dedicated dietitian is able to increase the caloric intake as far as the infants are concerned and giving healthy diet suggestions. We have a dedicated child life therapist that helps in explaining medical procedures to the children in a way that it makes it like play and makes them much more relaxed.
The two biggest areas of support that I remember from our time were pastoral care and social work. And I remember the chaplain stopping by our room a couple times. If we wanted to talk, he was there to listen. Our social worker was a godsend, setting up all of the deliveries to our house, ordering all the supplies that we needed, making sure we knew what resources were available in terms of insurance and in terms of community support. With her help, we were able to make it home and make it home successfully.
We want families to understand that they're part of the care of their child so that we're on the same team to help their child be, well again and be home with them.
And because you're treated as part of the team here, there is no question that you shouldn't ask. Whatever's on your mind, your nurse, the physician, whoever's there will answer you and answer in terms that you can understand.
You cannot really deliver this complex care without knowing the family's interests, needs, what is right for them.
And we recognize that it's difficult, that it can be very scary to be told that your child needs heart surgery. I think that's one of the things that makes this a great place, is that we all do recognize how much trust the parents are putting in us.
One thing we hear from families who have chosen to have their care with us is how comfortable they become with the team that they work with. The hospital support team on the floor, they just get to be family with the family.
We see that all the time. We get cards for Christmas with the pictures year after year, and they write in there that we become part of their family. When they have an appointment in outpatient clinic, they come up to the cardiac ICU and the cardiac inpatient unit to see how everybody's doing and to let us know how their child is doing, which is very rewarding for everybody.